The next type of reasoning that I'm addressing now is pragmatic reasoning. So pragma means action or work done in Greek. Pragmatic is about dealing with things in a realistic way based on what's practical as compared or as opposed to the theoretical knowledge that we may be having. Pragmatic reasoning can be considered to be the frame that surrounds the whole professional reasoning. So even if we're going to use our ethical reasoning, our scientific reasoning, our narrative reasoning, what is going to matter at the end of the day is what the practicalities around the decisions that we would want to make. So pragmatic reasoning can be considered, according to Shell and Shell, can be considered to be that frame which surrounds all the reasoning that we do in practice. All therapy happens in real world rather than in some idealized notion of the optimum situation. And occupational therapists are required to see things as they really are and find ways to deal with the things, including the issues that affect therapy. And these issues could actually be going beyond just the client-therapist relationship. There are bigger contexts that can actually influence the decisions that we make when we're working with our clients, as you will see in the coming slides. Pragmatic reasoning is the thinking that is focused on everyday realities that affect the delivery of service. So usually we use pragmatic reasoning when we're faced with situations that are not ideal in order to ensure that we provide the best quality service to our service users. So when we're looking at pragmatic reasoning, there is the practice context and then there is the personal context. So within the practice context, these aspects like the organizational norms, the policies within an organization, the protocols, the guidelines, each organization will have certain protocols or certain guidelines in terms of how they provide services, and these differ from one organization to another. So as occupational therapists, we need to have an awareness of the context in which we are practicing, because the final decisions that we'll be making with our service users, they will need to be within the confines of the practice context that we are in. Equipment available or other resources that are available within a setting, they will, at the end of the day, lead us to make certain decisions. Available staff members, is the setting understaffed or is it overstaffed? That practice context will then inform the sort of decisions that we make with our service users. The issues to do with time, do we have specified duration to see the patient in our service? If so, then the assessments, the interventions that we are providing, we need to make sure that it's the assessments that are fitting into that duration that has been allocated. So if an assessment, a standardized assessment, is designed in such a way that it needs an hour for you to complete with a service user, and within your setting, you do not have the liberty of working with a patient for an hour, then it means you might need to explore another assessment that could be more appropriate for that particular setting. So that's the pragmatic reasoning that we use. Also to do with location, how do service users access the services? For how long do they travel before they get to the service? What means of transport do they use to get to the service? This will then inform some of our decisions that we make when we are discharging patients, for example, or when we are booking patients to come for an outpatient visit or an appointment. So these are all considerations that we need to be making when we're using pragmatic reasoning. The personal context, looking at the therapist is a person with their own personality, their own competencies, their own life experiences, their own skills and professional skills, their own attitude, their own subjective norms, and their own abilities. So the therapist is bringing to the therapy context who they are as an individual. And it's also a context that needs to be taken into consideration. For example, if a therapist has been allocated a service user and they feel that the needs of the service user are beyond their skills or competencies in helping this to help this service user. Then with pragmatic reasoning, then they need to make a decision in terms of what can be done. Do they need to go back to their supervisor, or do they need to liaise with another team member? So it's about understanding the personal context and making decisions. The client or the service user, they also bring their own unique personal context because they've got lived experiences, they've got a level of understanding of their condition, and they might have had some historical interaction with OTs, and they're bringing that knowledge and those experiences into the therapeutic process. So all these factors, they need to be considered when we're using pragmatic reasoning. That image there is just sort of like summing up what I was talking about, and this is presented by Shell and Shell as the ecological view of professional reasoning, where there's the practice context, there's the therapist with their personal lens and professional lens, and then there is a client with their professional lens and their client's lens. So when we're using pragmatic reasoning, we are taking into account this transaction between the therapist, the client, in their context. And the reasoning is shaped by our personal as well as our professional perspectives. The reasoning is also shaped by the client's life experiences, the characteristics of the client, as well as the situation that they are in. So that's pragmatic reasoning. It's really around making those practical decisions based on what is practical, what is happening within the context that we are in. There are other types of reasoning. For example, interactive reasoning. This relates to the way in which we interact with the service user, the way we use our voice, our gestures, the sitting position, the tone of voice, the empathizing mode, really, the use of humor, all those aspects, they are part of interactive reasoning. And then there is conditional or predictive reasoning. It's also sometimes called future think. This is reasoning that is normally used by experienced therapists when they make plans that are focused into the future, maybe 2 years or 3 years or long-term future, but based on the experiences of the therapist and their understanding of the situation and a good understanding of how things might turn out. So that's conditional reasoning. There's also collaborative reasoning, which is about making collective decisions within the team. Multidisciplinary team members make decisions together collaboratively, and all of them as a team, they're actually responsible for the decision made. And then there is political reasoning. Political reasoning is about the issues to do with power. When we interact with service users in therapy, they are usually power imbalances with therapists having power. So political reasoning is really about distributing that power to the client so that the client can be making so that the client can be empowered to make decisions. So that's what political reasoning is around. It's also around advocating on behalf or together with the client, advocating for the right services that the client needs to be having or to receive. Right. Evidence-informed decision making. As you can see, I've underlined informed decision making. I did not say evidence-based decision making because there's a difference between evidence-based decision making and evidence-informed decision making. This is about blending sources of information in order to inform our practice. We're looking at evidence that has been published. We're looking at the clinical experience of the OT and the expertise of others. We're looking at the values, the goals, the preferences, and the wishes of the client, so resources that are available. We're actually bringing together all the different types of reasoning, really, to come up with what Shell and Shell call action decision, which is the best option that arises from a synthesis of information. So we're drawing information from a wide range of sources, and we are using a combination of the different types of reasoning: ethical reasoning, pragmatic reasoning, scientific, diagnostic, narrative. We're combining all these to come up with an action decision. So this is evidence-informed decision making as opposed to evidence-based decision making. So in evidence-based practice, we're looking at the evidence that has been published, and we are making our decision based on that evidence. But in evidence-informed decision, we are looking at all the other aspects, including evidence that has been published, and then we are using our synthesis of all this information to make an informed decision rather than an evidence-based decision. Okay, these are the references, and thank you so much.